name is Millicent Price, and today I will be discussing my case analysis for the case of Felicia. I will start by answering a couple of questions. The first question is, are there any aspects of Felicia's life that you can relate to? While I cannot relate to Felicia's situation through direct experience, I do resonate with her circumstances through what I have witnessed with my own family. I have seen, the impact of substance use on parenting and child welfare firsthand. In my family, my great-grandmother assumed full responsibility for raising my cousin's 3 children due to my cousin's struggle with drug addiction. Observing that experience gave me insight into how addiction can disrupt families across generations and how children are often deeply affected by the circumstances beyond their control. So this allows me to approach Felicia's situation with empathy and understanding, even though our life experiences are different. Second question, if not, what approach will I take in establishing Rampart? In establishing Rampart with Felicia, I would prioritize a non-judgmental, empathetic, and trauma-informed approach. And I keep, I just would piggyback off of the question, Felicia's initial question, are you going to help me get my kids back? Which signals that, she's afraid and, it's a serious matter to her. And so I would say, just her question alone signals fear, urgency, and mistrust rooted in her history with authority figures and systems. Acknowledging her concern directly and affirming that my role is to support her goals while also being honest about the process. I believe that will be essential. Building trust would involve active listening on my behalf, validating her emotions, and emphasizing collaboration rather than control. The next question, on what aspects of Felicia's family history can in part explain Felicia's dependency on substances? Well, I think several aspects of Felicia's family history help explain her dependence on substance. She experienced early childhood sexual abuse, neglect, parental substance use, repeated losses, and even placement in foster care. These adverse child experiences likely contribute to unresolved trauma, emotional dysregulation, and limited exposure to healthy coping strategies. I would say substance use may have become, a way for Felicia to manage stress, numb emotional pain, and function in daily life, particularly while caring for young children with minimal support. The next question is, what additional information do you need to gather to determine whether Felicia has substance use disorder based on the DSM-5. To determine whether Felicia meets the criteria for substance use disorder under the DSM-5, additional information would be needed. This would include the duration or frequency of her substance use, any unsuccessful attempts to cut down cravings, tolerance, withdrawal symptoms, and the extent to which substance use has interfered with her responsibilities, relationships, and safety. Clarifying whether her use persists despite negative circumstances would also be crucial. The next question, are there any other mental health issues that you think Felicia is experiencing? And beyond substance use, I believe that Felicia may be experiencing other, other mental health concerns. Her presentation suggests possible trauma-related symptoms such as anxiety or emotional distress related to her past abuse and recent loss of custody. Symptoms of depression may also be present given her appearance, unemployment, relationship loss, and, current stressors. A comprehensive mental health assessment would be necessary to fully understand her needs and to develop an effective, integrated treatment plan. Overall, Felicia's case highlights the complex interplay between trauma, substance use, and systemic involvement. Approaching her with compassion, cultural humility, and a strength-based perspective would be essential to supporting both her recovery and her goal of reunification with her children. Thank you for listening.